guys, it is May the 29th, 2024, and today I want to discuss something that I promised one of the subscribers I would discuss in today's video. One of the subscribers is having a problem with ascites and having a hard time getting it off, and I said I would make this video today just for them. I've talked about this multiple times, and I think that ascites is by far the worst part about this. And I just want to go ahead and start off today's video by saying this. First of all, I'm not a medical professional, I'm not a doctor. I say this in a lot of my videos, but I'm not. And I'm just telling you what I've done that has helped me. But I do want to preface this video today by saying that if you think that you have ascites, please go to a doctor. Go to the emergency room. Go see someone. Ascites means there are some serious issues going on. You just don't get ascites just out of the blue. Ascites is one of those symptoms that comes along with, some other thing. It's not just related to cirrhosis in general. That's not. Although cirrhosis is the majority of the cause for ascites in most people, there are other causes for ascites. And the thing is with ascites is that if you think that you are having ascites, there is an underlying cause there that is causing the ascites to happen. You need to find out what's going on with you, and the doctors can do some tests, depending on what they think it might be, but there are some tests they can do. They're not very complicated, but they might want to do an ultrasound, they might want to do a CAT scan, they might want to pull some of that fluid and do a paracentesis and test the fluid that's inside of your belly. There's a bunch of things they might want to do, but they need to find out what the underlying cause is for the ascites so that they can address that. Just trying to address the ascites is not going to fix the ascites. They need to find out what's going on that's causing the ascites. And like I said, cirrhosis is the main cause for most people that end up with ascites, but there are other causes for ascites. One of the causes is, of course, cirrhosis. Another one of the causes can be from cancer. Another cause of ascites can be from portal hypertension. And another cause can be from pancreatitis. And there's a couple of other ones as well, but these are the main ones. But once again, if you think that you have ascites, please go get checked out, because they need to address the underlying issue, what is causing the ascites for you. But let's talk about ascites today, what I did for myself to get rid of it, and just some things about ascites. Like I said at the beginning of the video, ascites is horrible. Your belly is full of fluid. Depending on how bad the ascites is, depending on how bad it's going to be. But ascites is just horrible. Your belly just gets full of this fluid. And it's not like the fluid is on the outside of the muscle in your stomach. The fluid is behind that muscle. So your abdominal muscle will have the fluid behind it. So when you get ascites, it's not going to feel like fat. You're not going to be able to pinch your belly. There's a difference between belly fat and ascites. It's back behind that abdominal wall, and it creates a lot of pressure on your abdomen. It will push on your abdominal wall, and you will feel it. It will be really, really tight. And when you go to the doctor or the hospital or whatever, and one of the first things the doctor's going to do is he's going to take his fingers and he's going to place them on your stomach and he's going to tap on it like that. And that's one of the ways they're going to determine if you do have ascites or not. When they start to tap on your stomach around, it'll kind of echo onto the other side. That's one of the ways that they're going to determine what's going on with you. And then depending, they might want to do a sonogram to take a look and see if there's a bunch of fluid inside that cavity, or a CAT scan or something like that. Um, Now, another thing about ascites as well is that if you try to lay down in your bed, you're not going to be able to do it and lay on your side. Uh, if you try to lay on your side, all that fluid's going to get pulled over and like droop over and hang. It's almost impossible to lay on your side. I made a video, I guess about 2 months ago, about how to lay in your bed with ascites. It's something that I developed. I tried laying in the bed all kinds of different ways. It was one of the most uncomfortable things because you really just can't get up and do a whole lot when you have ascites because it's so uncomfortable. But I made a video about how I like set my pillows up and all that kind of stuff, how to lay in the bed that I found to be the most comfortable for me. Am I saying it's going to work for you? I don't know. But if you're interested, go back and like I said, I think it's about 2 months ago. So it'd be about 60 videos back. But I made a whole video about just laying in the bed with ascites, if you're interested in watching that. Now, what can they do for ascites if they determine that you have it? One of the things that they can do, and they're going to want to do this in a hospital, in a sterile environment. I don't know of any doctor's offices that do it in office unless they're like located inside of a hospital. Now, there might be some that will do it in office, but they're going to want to make sure that it's a very sterile place where they're doing it. Is they can do what's called a paracentesis. And a paracentesis is basically they insert a large needle into your abdomen and it has a tube on it. I mean, it's a pretty simple setup and they basically just use gravity. So they'll put a long needle inside your abdomen, and they clean you up really well, and then they put like a little patch on you, and then they insert the needle through there. It doesn't hurt, and they'll give you like a local anesthesia so that you don't feel it when they put the needle in, but it doesn't hurt that bad. You get a prick when they're inserting the needle, but it's not horrible. And trust me, if you have ascites, you're probably going to want them to do a paracentesis just to get that fluid off. Now, a paracentesis is just a temporary fix. It's not gonna address the ascites in general. The thing about a paracentesis is it's going to pull the fluid off for now, but that fluid is going to come back again. It's like a temporary fix. It's like putting duct tape on something. You're really not addressing the cause of the ascites. But it can help alleviate some of that pressure. I've had a couple of paracentesis done, and it lasted a couple days, and the fluid came back. But it did give me some relief, because one of the things about ascites is it makes it really hard to breathe, especially if you're like kind of sitting up. All that pressure from the fluid in your belly is being pushed up into your lungs, and it's putting pressure on your lungs. It makes it very, very difficult to breathe when you have that. But if it's really, really bad, paracentesis does give you some relief for a short period of time. I've heard of people that had to go and have a paracentesis done, every week, a couple times a week, just depending. Now, I will tell you, it is something that they don't really like to do a lot, because every single time that they introduce that needle into your abdomen, the chance of causing an infection gets raised. And that's one of the problems with ascites, is that fluid in your belly can get an infection in it. And that's one of the things that they'll check for when they pull that fluid out. They'll check and see if there is an infection in there. And there's a couple other things they'll look for, like they'll check for certain proteins in the ascites fluid, and that can help them determine what is going on, what the underlying issue is that's causing the ascites, which they need to know. So if you do go in the hospital with ascites, most likely they are probably going to put a needle in. They're going to draw some of that fluid if they don't drain it all. But they're going to at least draw some so that they can test it, and they'll send it off to a lab and have it checked and see what's going on with it. But once again, it's a temporary fix. It's not going to fix the issue, and that fluid will come back most likely. And like I said, you can end up getting an infection from it. I ended up going septic. I was in the hospital in Columbia, South Carolina. They did a paracentesis, And right after that, I ended up going septic. I got very sick. They had to give me all kinds of antibiotics and stuff to help with that. I started running a fever. I was very, very ill because of that. It's another reason, if you think you have ascites, please go and get checked out. It's not one of those things where you just want to, stay at home and try drinking some kind of tea or something like that to get rid of it. It's one of those things, you need to go to the doctor. They need to see what's going on with you. So what's some more things that you can do? I talked about this yesterday, but not consuming more than 1,000 milligrams of salt or 1 gram of salt per day or sodium. Not drinking more than 2 liters of fluid a day. And these are all things that my doctor discussed with me. There's some other things they can do too, like they can give you diuretics like spironolactone. I was on spironolactone. I took it twice a day. I took 50 milligrams, cut it in half. I took 25 milligrams in the morning and 25 milligrams at night. I was also on furosemide, which is Lasix. So I was taking both. I will tell you this. If you go to your doctor and they prescribe you spironolactone, furosemide, this is one of those things where you're going to want to be mindful of, you need to be close to a restroom or somewhere to urinate most of the time. And if you have, let's say, a doctor's appointment or somewhere you need to be that morning, I would hold off on taking your diuretics and the Lasix for a little bit if you're going to have to go to like a function or something like that, because you're going to have to urinate a lot. And when I say a lot, I mean like 50 times a day. Like, you're going to the bathroom a couple times every hour and you're peeing like nonstop. The urge to go to the restroom, it just never goes away. You're constantly in the restroom urinating because it's getting that fluid out of you. Another thing as well is, and I talked about this yesterday, but consuming protein. Your liver needs protein. And I'm not really sure on the mechanics. I listened to a couple of shows today before I did this show, and I still don't quite understand how the protein plays in and prevents that water from leaching out into our stomach. But the protein helps, and it's one of those things that helped me tremendously. I was having problems with ascites. I couldn't get it to go away. Finally, my GI doctor was like, I want you to speak to my dietitian. I spoke to the dietitian. He told me, man, you need to be drinking protein shakes or eating enough protein daily because that helps. It does something with the blood and makes the molecules larger or something like that, and it prevents it from leaching into our belly. But once again, protein. I cannot stress that enough. Now, once again, I'm just telling you what I've done. But I consumed a lot of protein, and I started getting up and exercising and doing stuff. I found that to be tremendous in getting rid of the fluid. I've had ascites multiple times, and each time I've been able to get it off. Now, I will tell you, ascites does not go away. It's not like you get on diuretics and Lasix and it magically goes away in a week. No, this is something that takes a very long time. So I just don't want anybody to get their hopes up that they go to the doctor and they're going to get on these medications or getting these on these protocols, and then the ascites is going to go away in a week, because it doesn't. It takes time. You got to be patient. You got to hang in there. You've got to stick to the plan and just trust the process. It will eventually go away. Now, am I saying that for everybody? I don't know. I mean, I can't promise you that it will. But for a lot of people, it does. And like I said, it takes time. Sticking to the diet that your doctor wants you to be on, making sure that you're not consuming too much sodium, because that will make you retain fluid. Making sure that you're getting the protein in that your doctor talks to you about. Make sure you're taking your medications that they prescribe for you when you're supposed to take them, not forgetting to take your medication. not consuming too much fluid, because if you're putting in more fluid than you're able to get out, you're going to retain fluid. There's another thing they can do for you as well, which I had done. Now I've talked about this, but I went to the doctor. I had really bad ascites. I went and spoke with interventional radiology. They said they wanted to do a TIPS procedure. They told me that was going to fix, some of my problems. I went and had the first TIPS procedure. It was failed. I had a total blockage, basically, in my portal vein. And I had capillaries that were growing around the outside of my portal vein that was allowing blood flow. Their biggest, concern is that if another clot was to happen, that, my blood coagulated in some sort of way, and those capillaries got clogged up, that would just be it. So I went and had the TIPS procedure. I had the splenic thrombosis done as well. They were successful in cutting off the blood supply to half the spleen, but the TIPS procedure, the initial one, did not work out. And after I was in the hospital for 2 weeks during that period of time, I'd gotten the fluid completely off my stomach before I went in for that surgery. And from what I understand, they irritated my liver when they went in there, because they actually do go in through your liver. And a bunch of other places. They go in through your neck, they go in through your groin, they went in through like where my belly button is, and they went in through my side, through my liver. And I guess from them going in there and irritating my liver, I ended up getting, about a week later after getting out of the hospital, I started accumulating fluid again. And my belly filled completely back up again. And from January, I got back out of the hospital in February. So it was like February, March, April, May. I finally got the fluid back off again. Then I got a phone call from the interventional radiologist that performed my first procedure, and he wanted me to come back down and speak to him again. And when I went to talk to him, he said, "Hey, I'm leaving the hospital and I want to try one more time." And because they had told me initially that was it. They can't do it again, and the failed procedure was a failure. And when I went back and had the surgery the second time, that time it actually worked out. And they were able to do the TIPS. They were able to get that stent in there and all that stuff. And, once again, knocking on wood, but I haven't had a problem with the ascites since they did that. That helped out a lot, too. So if it's something that, you've been dealing with over and over again, you keep getting the ascites, it comes back, you get rid of it, it comes back. Talk to your doctor about a TIPS procedure. I really did benefit from having my TIPS done. I will tell you that the TIPS was pretty painful. It took a while to recover from that, and I was hurting pretty bad after they did that procedure. My stomach hurt really bad, but it did help. And I know not a lot of hospitals do the TIPS. I know MUSC in Charleston does the TIPS procedure. Emory in Atlanta does the TIPS. There's a hospital in New York City that does it, and I think the Mayo Clinic in Florida does it as well. But there's just not a lot of hospitals that do a TIPS. So you'll have to do your homework and figure that one out. I can say the MUSC in Charleston, they were really good. And the doctor that I had, he's no longer there. So you'll just have to do your homework and figure that one out. But once again, there's a lot of different reasons that you can end up with ascites. And it's not just from cirrhosis. One time I had pancreatitis, and it was the first time I got sick, and while I was in the hospital, I started to accumulate fluid on my belly. And the nurse, like the night before I came home, the nurse was saying, "You got ascites," and I didn't want to listen to her. And sure enough, she was right. I did. Was it caused by the cirrhosis or from the pancreatitis? I don't know. It could have been from both. It could have been from one. It could have been from the other. I'm not exactly sure. But it can be caused from pancreatitis as well. And cirrhosis and a couple of other things. So that's what I'm saying. You need to talk with the doctor and see what they say. Because they need to address the underlying issue of what might be causing that. Because until they address that issue, they can do all the paracentesis that they want to do, but that fluid is just going to continue to keep coming back. And you don't want to be on Lasix for a long period of time or diuretics. They're not good for you. It's kind of a short-term fix. I had so much fluid at one point in time, It was in my legs. I had edema in my legs. It was in my thighs. I had fluid all in my belly. I mean, it was horrible. You do not want it to progress to that point. I just can't stress that enough. Eating a healthy diet, raw fruits and vegetables, making sure you're getting enough protein. You're not eating a lot of processed foods, not drinking a lot of soda. I mean, no soda. You really gotta be careful with your diet, and absolutely no alcohol. If you have ascites, you got to stop drinking. That is not helping your situation at all. And I'm not preaching, I'm just telling you that continuing to drink with ascites is just like adding gasoline to a fire. You do not want to do that. But once again, that's basically the things that I've done, the things that helped me. And like I said, the protein helped a lot. Drinking water and not drinking soda, juice, or any of that kind of stuff. Staying away from all processed foods. Processed food is just loaded with sodium and sugars and all that kind of stuff. You do not want to be consuming a lot of sugar either. That stuff is hard on your liver. You really got to eat clean. You got to try to get up and exercise. I know it's difficult. I know how hard it is. You've got all this weight on your belly. It's pulling you down. It's making your back hurt. It's horrible. You can't keep your pants up because your belly's poking out so far, and where it'll sit really low in your belly, so it's gonna hang down really low and right in your pelvic region. You're gonna have fluid right there as well, and that makes it really hard to keep your pants up because, especially with me, because during that period of time I was so skinny too. I had absolutely no butt at all. You could iron your clothes on my butt. I'm not kidding. So without having a rear end and then having this belly that was distended, I just could not keep my pants up. I was constantly pulling my pants up, and it doesn't matter. You can have a belt on or whatever, but it's making your pants sit so low that they will not stay up. So it's just one of those things that, it's horrible. And for any of you guys that are out there suffering with ascites right now, I'm so sorry. I can totally understand where you're at. I understand how you feel. And, once again, I apologize. And I'm so sorry for you. I know how uncomfortable it is, how embarrassing it is. You don't want to go anywhere. I remember just going to the doctor's office and how embarrassed I was. I remember one time going to MUSC, and I had to go down there to speak with my liver doctor. I had ascites really bad. I was wearing a 2XL shirt and jogging pants because I just couldn't. I had to have elastic pants on all the time because the ascites was so uncomfortable. And I remember walking into the hospital that day and looking at all the people that were living their normal life. People just walking in and out of the hospital as I was, slowly walking in. I was in so much pain because it really hurts. It hurts your stomach. Your stomach hurts really bad from it. It puts so much pressure on your ribs. Your ribs are going to hurt. Your back is going to be killing you. It just causes so many problems. But like I said, I was standing out in front of the hospital. My mom had just dropped me off at the drop-off point in front of the hospital, and I was standing there waiting for her to park so that we could walk in. And I was watching these people walk in and out of the hospital, and I was thinking to myself, they have no idea how lucky they are, and they just don't know. I was thinking to myself, all the days I took just being normal, I took that for granted, and how much I missed just being able to walk around like a normal person without all this fluid on my belly and all this weight pulling my back down. It's horrible. And it's just another reason why not to drink. You do not want to get ascites. I can promise you that. It is horrible. I've said this over and over again, but it is by far the most uncomfortable thing. It's the most embarrassing thing. It is just horrible to have. And once again, if you have it right now, I'm so sorry. And I really hope that you can get it off as soon as possible. But please, if you feel like you have ascites, if you're starting to get, your belly's starting to poke out, please go see a doctor. I'm sure you guys have seen people that are, we've all had that uncle or aunt or somebody in our family or a friend, that person that always drank a lot. They've always got that really big belly, and they're older. Not necessarily, doesn't necessarily have to be ascites, but, if they're a big drinker, it most likely is. And, there's things they can do to address it. And, your life will be so much better without that fluid on it. I can tell you that much. But anyway, guys, that's what I wanted to talk about for today. I hope you guys enjoyed today's video. I know it's kind of depressing, but I needed to talk about it. And like I said, I told the subscriber that I was going to discuss this today. So thank you so much for watching. I really do appreciate it. And I'm sorry that it's taken me so long to get to the comments. Last night, the video got posted up late. I was really tired, and then this morning I had to get up and go to the endocrinologist, and I'm just now getting home just a little bit ago. I jumped on, replied to all the comments, and went ahead and filmed today's video right after I did that. So hopefully I'll be able to catch up and keep up with them tonight. I'll just have to see how long it takes for this video to get uploaded. I still don't have my fast internet yet. Or my high-speed internet. Hopefully it'll be soon, but as soon as I can get that, I can get these videos up early every day. It's just gonna make my life so much easier. And if I can get the videos up earlier, I can respond to the comments earlier, and it'll just make things move so much easier for me. But I still have yet to see them, so as soon as they get out here, I'll let you guys know. I still haven't made a decision yet on what I'm gonna do as far as the website or whatever. I just haven't had a lot of time. I'm going to get to it before the end of the week, so keep an eye out for that. And I do plan on doing a live this week as well. Probably going to try to do it again either Friday or Saturday. I'm not exactly sure yet, but I'll let you guys know tomorrow. But I am going to do a live this week. I'm sorry that I couldn't get one done this past week. I tried, but my internet was just not working. It would not agree. I sat on there for 20 minutes trying to get to work, and everybody kept telling me that the picture was pixelated, and they could hear my voice, but they couldn't see me, and it was just giving me a lot of problems. So hopefully this week it'll work out, but I am planning on doing another one, and I'll let you guys know in tomorrow's video what day that's going to be. But once again, guys, thank you so much for watching today. I really do appreciate it, and until tomorrow, I will see y'all then. Love you guys so much. Bye.